Etofenamate is a nonsteroidal anti-inflammatory drug and SAID that is used primarily as a topical medication for pain relief and inflammation. Its pharmacology includes the following key points. Mechanism of action. Etofenamate works by inhibiting the activity of cyclooxygenase COX enzymes, specifically COX1 and COX2. These enzymes are involved in the production of prostaglandins, which are chemical messengers that play a role in pain and inflammation. By inhibiting COX, Etofenamate reduces the production of prostaglandins, leading to pain relief and decreased inflammation. Topical application. Etofenamate is typically applied topically in the form of creams, gels, or ointments. This allows for localized treatment at the site of pain or inflammation. Indications. Etofenamate is used to relieve pain and reduce inflammation in conditions such as musculoskeletal disorders, joint pain, arthritis, and soft tissue injuries like sprains and strains. Absorption. When applied topically, Etofenamate is absorbed through the skin and exerts its effects locally. It has limited systemic absorption compared to oral NSAIDs, which can reduce the risk of systemic side effects. Precautions. Etofenamate should be used with caution in individuals with a history of hypersensitivity to NSAIDs or skin allergies. It should not be applied to broken or damaged skin, mucous membranes, or near the eyes. The dosage of Etofenamate can vary depending on the specific product and the condition being treated. Etofenamate is typically available as a topical cream, gel, or ointment, and the recommended dosage and frequency of application may be indicated on the product label or provided by a healthcare professional. In general, for adults and children over the age of 12, the typical dosage and application instructions for Etofenamate may include 1. Apply a thin layer of the topical product to the affected area. 2. Rub the medication gently into the skin until it is absorbed. 3. The frequency of application may vary, but it is often recommended to apply Etofenamate 3 to 4 times daily. 4. Do not use more than the recommended amount or apply it more frequently than directed. 5. Wash your hands thoroughly after applying Etofenamate to avoid accidental contact with the eyes or mucous membranes. Etofenamate is generally considered safe when used as directed, but like all medications, it can have side effects. The most common side effects associated with Etofenamate, especially when applied topically, may include 1. Skin irritation. This is the most common side effect. Some people may experience skin redness, itching, or a burning sensation at the site where Etofenamate is applied. This irritation is usually mild and temporary. 2. Allergic reactions. In rare cases, individuals may develop an allergic reaction to Etofenamate. Symptoms of an allergic reaction can include rash, hives, swelling, severe itching, and difficulty breathing. 3. Photosensitivity. Etofenamate can make the skin more sensitive to sunlight. It's advisable to avoid excessive sun exposure or use sunscreen on treated areas to minimize the risk of sunburn. 4. Localized skin reactions. Some people may develop contact dermatitis or other localized skin reactions when using Etofenamate. If you notice persistent or severe skin changes at the application site, consult a healthcare professional. 5. Dry skin. In some cases, Etofenamate may cause dryness of the skin in the treated area. 6. Eye irritation. Avoid contact with the eyes, as Etofenamate can cause eye irritation. If accidental contact occurs, rinse the eyes thoroughly with water. 7. Gastrointestinal effects less common. Although Etofenamate is primarily used topically, there is a minimal risk of gastrointestinal side effects compared to oral NSAIDs. However, if a significant amount is accidentally ingested, it may cause stomach irritation, nausea, or other gastrointestinal symptoms. Etofenamate is primarily used topically, which means it has a lower likelihood of interacting with other medications compared to oral NSAIDs, non-steroidal anti-inflammatory drugs. However, there are still some potential interactions and precautions to consider. 1. Other topical medications. When using multiple topical medications on the same area of the skin, there is a possibility of interactions. These interactions can vary depending on the specific products being used. It's advisable to consult with a healthcare professional if you plan to use other topical medications concurrently with Etofenamate. 2. Oral NSAIDs. While Etofenamate is a topical NSAID and has limited systemic absorption, there is a theoretical possibility of interactions if used in conjunction with oral NSAIDs, e.g., ibuprofen, naproxen. This could potentially increase the overall systemic exposure to NSAIDs, increasing the risk of side effects. Consult with a healthcare provider if you need to use both oral and topical NSAIDs. 3. Warfarin. There is limited information available regarding potential interactions between Etofenamate and warfarin, a blood-thinning medication. Some NSAIDs can affect the anticoagulant effects of warfarin, so it's essential to inform your healthcare provider if you are taking warfarin while using Etofenamate.